there are many treatment options. Medically speaking, we have the medical sciences are improved so much that we have a lot of treatment options. But in my personal opinion, one of the main philosophy of treatment for me as a doctor would be to assess what the problem statement is for the particular patient. If my patient is coming to me with a particular problem statement, I would focus on solving that particular problem statement rather than treating the MRI or treating the X-ray or treating the BMD DEXA scan. If most of the times my patients come to me with the problem statement, most commonest problem statement that I face is that they are not able to walk, or they are debilitated with pain to such a great extent that they are not able to carry on with their daily lives. This makes them, completely bedridden. Even if they don't want to be sleeping on the bed, they still have to be on the bed because they are in pain. So I tend to solve that problem. Now, depending upon what kind of severity, pain severity the patient has, or depending on what kind of other symptoms that the patient has, depending on my clinical examination of the patient, depending upon my counseling with the patient, I tend to have a one-on-one conversation with the patient about, try to understand what their actual problem statement is. That gives me a lot of information from their end. I make them talk a lot. So by them talking a lot, this gives me a lot of information about what am I supposed to actually treat. Am I supposed to treat just the MRI causing a slip, which is showing a slip disc and a foraminal or a canal stenosis, or am I supposed to treat the patient's problem, right? So where will I get that information? I'll get that information by talking to the patient. I'm making them talk more than I would talk. So this gives me information, and that is how I deploy different methods, whether it is conservative methods or any surgical methods. And based upon the information that I receive from my patients, I deploy various methods to treat my patients. So most of the times, 90% of the problems can be solved by having a heart-to-heart conversation with your patients, and trying to solve their problems rather than just trying to solve the X-ray or the MRI. So this gives me an edge in understanding the actual problem statement, and then I would tend to solve it accordingly. If the most of the times, as I said, 90% of the times things get evaluated initially, and after initial evaluation, they get treated conservatively with medications, with physiotherapy, with things like root blocks. So these kind of conservative methods definitely help patient in the long run. Nonetheless, if the problem is way too severe, or if all the conservative methods have completely been exhausted and not given a desired result in solving that particular problem statement, that is when I advise surgery. And after the surgery, that I make sure I communicate with my patients, okay, if we go ahead with the surgery, your problem statement will be solved. And that is my aim when I want to give surgery as a treatment modality for my patient. My surgery should make the problem solved. It shouldn't aggravate the problem, or it shouldn't be like that after operating on the patient, the problem still persists. So if that is going to be a foreseen future, I would rather advise them that operation is an option, but it is not going to solve your problem. So I communicate all these things. I tend to communicate all these things as a part of my patient counseling. If surgery is going to give you benefit, or if it is not going to give benefit.